If you want to learn to think like a nurse and save yourself a ton of study time, plus a lot of stress from worrying that you didn't study the right information, then this is the video for you. It's going to be a little bit longer than my normal videos, but stick with me to the end because I promise you'll make it worth it. Also, you can still see the swelling from my wisdom tooth extraction from this weekend, but it is feeling much better. Speaking of my wisdom tooth extraction, after I finished, I posted a pop quiz on my profile page. This was the original post. And I was specifically asking about why you don't use a straw after wisdom tooth extraction. A lot of students chimed in with the answer of dry socket. Google it if you don't know what it is. And nursing students are going to hate me for this one, but it's not the best answer. Here's why. When you're thinking like a nurse, you really need to make connections between the information. I teach my tutoring students to do this using the Silver Bullet study system, which is a 4-step process that mimics the way experienced nurses think. So let me give you an example. And I'm also going to show you how this actually saves you study time in the long run and helps you retain information long term. Step 1, you have to know what normal looks like in the mouth. What does a normal mouth look like? Guess what? You probably know a lot about this already because you're a functioning adult. And any additional stuff that you need to know, you should have learned in your anatomy and physiology class. But step 1 is all about focusing on what's normal. Step 2, I call the Humpty Dumpty factor because Humpty Dumpty sat on the wall, Humpty Dumpty had a great fall, and now he's broke. So what breaks in this case? In this case, for the wisdom tooth, the tooth was being extracted, which means that there's going to be a gap. Healing needs to take place. FYI, the natural, normal healing processes is something you should study in step 1 too. I mean step 1 also. Step 3 is where we really shift to thinking like a nurse. And this is the step where most students make the big mistake of trying to memorize a list of things versus just trying to understand it the way I'm going to show you how to do right now. Use what you know about normal, what you know about what broke, and then predict what's going to happen next. We predict that blood's going to fill in the gap, clot, healing processes are going to take place. We want that to stay intact, uninfected, right? There'll be some pain, soreness, swelling. Now let's move on to step 4, what to do about it. I teach several strategies for how to figure this out so you can think it through on your own, but let's focus on the straw. One of the things we need to do to care for this is to support the normal healing processes and let it recover. When you suck on a straw, it changes the pressure in your mouth, which puts more pressure on the blood clot, which can pull it out, and that's what leads to dry socket. But now that you know the process, you can apply this to any topic. Like when you get to peds, you'll already know no straws after cleft palate surgery too. Puts pressure on the sutures.